Dear students, Assalamu alaikum. In the last lecture, we studied about the immunization. In this lecture, we'll study the passive immunity and then the various disorders of immune reactions. Passive immunity, as you can see, is a branch of the acquired immunity, but it's different from the other branch, which is the active immunity, in that it is a temporary immunity and it can be achieved without any antigen being presented to the body. Now, how does this take place? This is done by administration of preformed antibodies or activated T cells, meaning that it's not the body of the individual which forms the antibodies or activated T cells. Rather, the antibodies or activated T cells are obtained from the blood that has been actively immunized against the antigen. Now, this blood may be taken from some animal in which that specific antigen was introduced. Now, what happens is that in case of the preformed antibodies, when administered to some individual, they last in the body of the recipient for 2 to 3 weeks. Activated T cells, on the other hand, last for few weeks if transfused from another person, or only few hours to few days if transfused from an animal. Now, such transfusion of antibodies or activated T lymphocytes to confer immunity is called passive immunity. You can see some differences between the active immunity and passive immunity in this chart. As far as the effectiveness is concerned, the active immunity takes time to develop, while the passive immunity can be provided on a short-term basis. The active immunity is long-lived if time duration is taken into consideration, and the passive immunity is short-lived. The memory cells are present in the active immunity, but not in case of the passive immunity. And active immunity has a poor or absent effect in immunocompromised persons, but the antibodies in case of the passive immunity are effective in immunocompromised individuals. So this is a comparison of the active immunity versus the passive immunity. Now let's move on to the disorders of immune reactions. The disorders of immune reactions can be divided into these four categories. First of all, the hypersensitivity reactions, then the rejection phenomena, thirdly, autoimmune diseases, and lastly, the immune deficiency diseases. We'll study these disorders one by one. Firstly, the hypersensitivity reactions. So what's hypersensitivity? A hypersensitivity is a condition associated with an exaggerated or an inappropriate immune response. So there are mainly four main types of hypersensitivity reactions: type 1, type 2, type 3, and type 4. Type 1 reactions. The type 1 reactions are immediate in onset, that is, they take place within minutes, and the antibodies involved are of the IgE type. The effector cells which carry out these reactions are the mast cells and the eosinophils. These type 1 reactions, they underlie the diseases like anaphylaxis, which is a serious allergic reaction that is rapid in onset and may cause death. The causes of anaphylaxis include insect stings, drug reactions, and foods. The person may be allergic to a certain type of food like the peanut butter or maybe any other food. Other diseases in which type 1 reactions are operating include the atopic diseases like rhinitis. Rhinitis means the inflammation of the nasal membrane. So these persons, they develop runny nose, sneezing during the spring weather when there are pollens around, asthma, and urticaria. Urticaria means the wheal formation, the reddish spots on the skin, which some persons develop time to time. So these are all examples of type 1 reactions, clinical diseases involving the type 1 reactions. Let's move on to the type 2 reactions. The type 2 reactions are of intermediate in onset, take hours to develop. Now, antibodies involved in these reactions are IgG and IgM. Effector cells are the neutrophils and the macrophages. And basically, these type 2 reactions are present in diseases like autoimmune hemolytic anemias or thrombocytopenia, or maybe the myasthenia gravis or Graves' disease. So in these diseases, the antibodies, they attack some antigen present in the cell membrane, or maybe some receptor, leading to these clinical disorders. Type 3 reactions. Type 3 reactions are also intermediate in onset, take about 4 to 12 hours. And the cells involved are basically the immune complexes. Yes, the immune complexes of the IgA, IgG, and IgM antibodies with the antigens. Now, type 3 reactions involve the neutrophils as the effector cells. And the clinical settings or diseases in which these type 3 reactions are present include the Arthur's reaction, which is basically a localized reaction, experimental reaction. If some antigen is introduced in the skin, it will produce redness, induration, and on the subsequent injection of the same antigen will produce necrosis at other sites away from the initial site of injection. Serum sickness is the systemic counterpart of the Arthur's reaction, and it underlies in disorders like glomerulonephritis and arthritis, in which the antigen antibody complexes, they damage the basement membrane of the kidneys. So these are examples of the type 3 reactions. Type 4 reactions. Type 4 reactions are basically the cell-mediated immune reactions, and they have a delayed onset, more than 24 hours, taking weeks even. And the cells involved are basically the sensitized T lymphocytes. And effector cells are the macrophages. The clinical diseases or disorders in which type 4 reactions are present are, number 1, the graft rejection, a very important clinical setting. Then the contact dermatitis, which is a skin disorder in which there is contact to certain substances or chemicals produces the inflammation, like contact with the nickel or with poison ivy plant. Then leprosy is another disorder in which the type 4 reactions may take place and damage the body tissues. So this is a very summarized account of the type hypersensitivity reactions. Rejection phenomena is the second main disorder of immune reactions, and rejection phenomena is seen after transplantation of body organ or tissues from one individual who is the donor to a patient which is the recipient. Now this is due to type 4 cell mediated immune reaction, as I mentioned a little bit earlier, against the donor tissue proteins. So whenever there is an attempt to transplant a body organ like liver or kidney, the recipient body rejects that organ or tissue donated from some other individual, and this is known as the rejection phenomena, and this is due to type 4 cell mediated immune reaction. Now this rejection phenomena can be controlled to some extent by these measures, including number 1, the suppression of lymphocytic activity by the steroids, which are the glucocorticoids, administration of anti-lymphocytic serum, or by the use of immunosuppressive drugs. The third main group of disorders are the autoimmune diseases. Now, these autoimmune diseases result when the body starts producing autoantibodies to its own tissues. So the causes of autoimmune diseases may be the release of locked up antigens, shared antigens, or alteration of self antigens, or presence of abnormal clones which have not been destroyed during the pre-processing of the lymphocytes. The autoimmune diseases may be organ specific or systemic in nature. The examples of organ specific autoimmune diseases include myasthenia gravis, purpura, which means pinpoint bleeding spots on the skin, rheumatic fever, diabetes, and certain skin disorders. An example of the systemic autoimmune disease is the systemic lupus erythematosus. Now, in this disorder, there are antibodies, autoantibodies, which are produced against many organs of the body. Lastly, the immune deficiency diseases. Immune deficiency diseases may be primary and secondary. The primary may result from defect in humoral immunity, or defect in cellular immunity, or defect in both humoral and cellular immunities. In individuals in which there is defect in humoral immunity, basically the bacterial infections are present. And in persons where there is defect in cellular immunity, mainly viral and fungal infections are present, because there are no antibodies or activated T cells to uh, uh, combat against these infections. If a certain individual has a defect in both the humoral and cellular immunities, he or she is highly susceptible to infections, and these may include infectious agents which are not ordinarily considered pathogenic. So even the opportunistic organism may produce the disease in these individuals. The secondary immune deficiency states are not caused by intrinsic abnormalities in the development or production of the T and B lymphocyte cells. Rather, they are secondary to other diseases like AIDS, malnutrition, cancers, or if somebody is being treated with the X-rays or immunosuppressive drugs. So this concludes our discussion about the disorders of immune reactions, and with it the white blood cells.